Good morning to all the respected doctors. Let me discuss with you on the topic, the Maxillary Osteomyelitis, a case series. What is osteomyelitis? It may be defined as an inflammatory condition of the bone that begins as an infection of the medullary cavity and Hawaiian systems of the cortex and extends to involve periosteum of the affected area. Osteomyelitis involving maxilla is quite rare when compared with that of mandible, which could be due to extensive blood supply, porous nature of the bone, thin cortical plates, and abundant medullary spaces. It is seen to affect all age groups, but it is mostly seen in infants, children, and older adults. It has a male sex predilection, but both males and females are affected. The factors that predispose to osteomyelitis are conditions affecting host resistance or defenses like diabetes mellitus, chronic alcoholism, malnutrition, compromised vascular integrity and perfusion in the host bone, and virulence of the microorganisms. The etiological factors are odontogenic infections like pulpal, periodontal infections, and tumors, trauma like middle third fracture, infections of the orofacial region like lacerations, peritonsillar abscess, and periostitis, and infections derived by hematogenous route. The pathogenesis is initiated by acute inflammation, hyperemia, capillary permeability, and infiltration of the granulocytes. Tissue necrosis results, which is due to proteolytic degradation and vascular thrombosis. And there is pus formation, which increases the intramedullary pressure, resulting in vascular collapse, venous stasis, and ischemia. Whereas compression of the neurovascular bundle accelerates thrombosis, ischemia, and infarction, later resulting in paresthesia and sequestrum formation. Osteomyelitis in immunocompromised. If maxillary necrosis occurs, it may be due to bacterial, viral, or fungal infection. However, long-term use of antibiotics or corticosteroids may also result in opportunistic fungal infections, which affects immunocompromised patients. Recently, it has been understood that COVID-19 is associated with immunocompromised states like diabetes. Now, how is diabetes associated with osteomyelitis? With increased blood glucose or hyperglycemia, there will be glycosylation of the protein like transferrin. With the accumulation of ketone bodies, there will be impairment of the ability of the proteins to chelate iron. As a result, there will be increased glucose, iron, and ketone bodies. This results in acute fungal infection and bacterial infection. Lately, based on the cases presented in clinics with established relationship of osteomyelitis and immunocompromised like diabetes, hypothesis that COVID-19 is interrelated with osteomyelitis can also be noted. Based on the cases seen in the clinics, here we discuss 5 cases of osteomyelitis with fungal and bacterial infections involving the maxilla. The history revealed that all the 5 patients were COVID positive. All the patients were under medications due to diabetes, with 1 patient with medication for hypertension also. And among the 5 patients, 1 patient was affected with bacterial as well as secondary fungal infection too. To conclude with, osteomyelitis is the oldest disease known from the literature. But fungal osteomyelitis is a rare entity usually seen in patients with diabetes and immunosuppression. Taking COVID-19 into consideration, it is understood that there is an interrelationship between osteomyelitis, immunocompression like diabetes in this case, and COVID-19. Care should be taken in accurate diagnosis through investigations such as histological, microbiological like antibiotic sensitivity testing and culture sensitivity, and radiological like CT and MRI. However, identification of fungal species can be done only through the culture. Accurate antibacterial and antifungal treatment with definite surgical treatment like extraction of the affected teeth, sequestrectomy, saucerization, and jaw resections can be done. With management is needed. Thank you.